partners that we're working with at this Summit Service Center are Amita Health and Pillars Community Health. We're also working with NAMI Metro Suburban. Part of developing a safety net in a community is viable, vibrant, well-run organizations that are constantly examining what the needs are in the community and working to address those needs, looking around the country to see what models work, and just trying new things. And we've always had a partnership with Pillars Community Health. They've provided on-site nursing, they've provided flu shots, they've worked with us to preference clients that need medical appointments at their clinic. And several years ago, they've partnered with the residency program at Amita Health, and they invited Amita Health to come in through the leadership of Dr. Jennifer Sawyer to run a community rotation for their residency program on site at beds. They did this through the Federally Qualified Health Center, and they did it in partnership with the residency program. And we saw a significant increase in the number of people who were willing to take advantage of medical services. We saw a few life-saving changes that were noticed by the residents, things that were immediately addressed that would have could have been a much more critical circumstance. We were able to work with people at follow-up care, specialty care, and medication management. And so we saw dramatic improvements in our overall health of our clients. And so building on that idea, one of the gaps in the services that we identified was that even though we were providing shelter, those people that had the most severe medical circumstances or had compounding medical conditions, those individuals had the hardest time following through with appointments. They had the hardest time healing because we were asking them to move from site to site each day. Many of them were on walkers. They were unable to sleep laying down. They needed a lot of specialty services and care, and so that particular cohort was still rotating in and out of the emergency room for care. One of the main reasons we embarked on a Summit Service Center medical respite program is because we wanted to make sure we were caring for those individuals that were most in need. They could stay in one location 12 months out of the year. We can provide on-site services, so there's no barriers to care. There's a relationship that's developed between the caring physicians and those residents who are staying at the facility and have the need. We also worked with Amita Health to talk through their discharge planning. And so as clients are discharged from hospital systems, they can come directly to care at the Summit Service Center. And we will work with those individuals to provide transportation, provide follow-up care, and manage their medical conditions at a single place, even though they are without a permanent home, while we work on getting them into a permanent location that they can sustain. If you've worked with a person who is homeless, if you have a family member or a loved one who struggled through a medical condition or multiple medical conditions, you know that what they need is permanency. What they need is the assurance that there's a place that they can go to heal. And what we're asking today is that you would provide whatever financial support you could to support this important safety net development within Southwest Suburban Cook County. It will provide a place for people who are being discharged from the hospital, neighbors who find themselves homeless, but need a place to go to transition into a permanent location where they can stay or can be a part of the community again.